You ever wonder which muscles were involved in the exercises you're doing? Or perhaps you just wanted to know which exercises you should be doing if you want to target certain muscles to look a certain way. Perhaps you were curious as to why you had certain pains and which muscles were involved in those painful areas. We'll be looking at 3 sets of videos where we'll be exploring the action of each of these muscles. Part 1 of the 3 videos will include muscles involving facial expression, mastication or chewing, and muscles acting on the head, neck, and shoulders. The first muscle we'll begin with is our frontalis, which is sitting right in front of our frontal bone. This muscle is attached to this tendon here that's called the Epicranial Aponeurosis, and this epicranial aponeurosis will then sweep all the bone here to the posterior side of our head, attached to the occipital or occipitalis. Now technically this is considered one muscle here, and it's known as the Occipitofrontalis. However, we're going to be taking a look at just the frontalis portion of this muscle. Now, so we know one attachment site for our frontalis here, that epicranial aponeurosis. So that's going to be our origin. So the origin anchors a muscle, and then its other attachment, which is the site that will be moving once our muscle contracts. The insertion of this muscle is the brow or the eyebrow portion of our skin here. And so when the muscle contracts, it's going to cause the elevation of our eyebrow. And so the facial expression would be one in which we'd make when we were surprised about something. The next muscle we're going to explore is the Orbicularis oculi. And that's this circular muscle here that is just around our eye or our oculi area. And so this muscle has 2 attachment sites as well. It has the origin, which is just on the corners, the inside corner of our eye. If we look at it just a bit closer here, we can see that the origin is on the lacrimal bone, as well as that medial portion will actually be on the folds of our eyelids or just around our eyelids. So when a circular muscle controls closing this opening in the center, so basically it's going to be involved in winking. Next is the nasalis, and so just the way it sounds, it's at the front of our nose here, and its 2 attachment sites will be on the top of the nose. This is actually the insertion, and then the origin is just below where our nares or the bottom of our openings to our nose would be. So the nasalis has a couple actions here. On the superior portion, it'll actually cause the bridge of the nose to sort of compress or depress downward, and then the lateral portions will cause the corners of the nostrils to sort of like elevate. The next 3 muscles of facial expression we'll be exploring are those involved in smiling or laughing. The first one is called the LAVATOR LABII SUPERIORIS. Now this one runs up and down like this, and its origin is just inferior to the orbital or the eye, attached to the zygomatic and the maxilla bone. Its insertion, you can see, is not attached to a bone at all. It's actually to the lateral and superior portion of our lips. And so when there's a contraction, it's going to draw the side of the lip upward over here. The next muscle to know for smiling is called the Zygomaticus. Now there's technically 2 Zygomaticus muscles. We have the minor and then we have the major. For simplicity, we're just going to take a look at this one. Now its origin is the zygomatic bone, hence its name, and its insertion is not involved in bone, but it's the corner of our lips here. So on the would be the corner and lateral upper or superior portion of our lip. So when there's a contraction, it's going to draw the corners of our mouth toward our cheekbones. And the last of the 3 that we'll be exploring involving smiling is this muscle called a Risorius. Now this one will actually not have an attachment at all to our bones. In fact, as you can see here, there's none. And so the origin will be on the sides, sort of the middle side portion of our cheek, and the insertion will be on the sides of our mouth, or the lateral corner portion of our lips rather. And so when we when this contracts, it'll draw the corners of our mouth toward our cheeks. And in fact, when that happens, it causes sort of like the center of our cheek to sort of buckle inwards, creating that dimpled look to our cheeks when we smile. The last of the muscles for facial expression involve opposing action of that of the smiling muscles. The first is the Orbicularis oris. It is a circular muscle whose origin is on the mandible and maxilla. It has two locations on either side of the mandible and maxilla. You have the superior portion. The superior origin sits just above the canine and the incisors on both sides, as well as the canine and incisor on the inferior portion, but on the mandible. Its insertion is on the skin or the lips. And so during contraction of this muscle, the circular muscles will tend to draw or close in the opening just between. So pucker in or pucker as if you are kissing someone. Now the Mentalis muscle here is pretty deep here. Its origin is on the mandible, just below the incisors here, and its insertion is on the skin of the chin. And so during contraction, it'll actually cause your lower portion of the chin to draw upward, and as a result, it'll also force your lower lip to kind of protrude outward as if you were pouting. The next muscle is the Depressor anguli oris, and that's this one here. And its origin is on this muscle here called the platysma, as well as the lower portion of your mandible, so sort of like at that edge of the mandible. And its insertion is on the corners of your mouth. And during contraction, it'll draw the corners of your mouth downward and at an angle as if you're frowning. And the last of the muscles technically is not a facial muscle, but I thought it very appropriate to include here. This muscle is called the genioglossus, and it's actually inside of our mouth, not on our face. So this muscle has an attachment on the inside part of our mandible, just in back of the mental, and its insertion is on the inferior portion of our tongue. So during contraction, it'll actually cause your tongue to protrude outward. Now onto muscles of mastication or chewing. There are two muscles involved, the temporalis as well as the masseter. The first of the muscles of mastication is the temporalis. This muscle is located just on the side of our temporal bone. Its origin is on the temporal parietal bone and the frontal bone, and its insertion site is on that coronoid process located on the mandible. During its action, it's going to pull on this angle here. At an angle, it's going to help to elevate our mandible. Now the masseter muscle here is a large muscle, and it's located all along the ramus of our mandible. Its origin is on the zygomatic bone as well as the temporal bone here. So we can kind of see this over here if I zoom in. We've got an origin here, and its insertion is on the mandibular angle as well as the ramus here. Now in this animated video we can see the action, and so when it turns that bright yellow, it's showing us that it's been activated as it lifts, but in particular being sort of at that angle, it's really helping to clench our jaw closed during that the chewing process. The last set of muscles in this series are those acting on the head and the neck. We'll begin with this anteriormost muscle that forms a sheet along the anterior and lateral portion of our neck. This is called the platysma. Its attachment site or its origin is on the deltoid muscle as well as the pectoralis major muscle, so no bone attachment. And its insertion is on the inferior border of the mandible. Its action is to depress or lower the jaw. We're going to take a look at the trapezius muscle, which is on the posterior side of our neck. It's technically a much larger muscle. It comprises all of this here, but we're going to look at just the upper portion because it'll have more to do with the movement of our neck. This particular muscle will have its origins on the acromion process of the scapula as well as the acromial end of the clavicle, and its insertion is on the occipital bone of the skull. It has several actions when engaged, but the one we're going to be looking at for the superior portion of this muscle, so after the neck has been flexed, it will extend it and then hyperextend. Our sternocleidomastoid. Now this muscle has two origins. Its first origin here is on the sternum, the manubrium portion of the sternum, and its second origin is along the sternal end of the clavicle. Its insertion is on the mastoid process on the occipital bone. Its first action is in a flexion of the neck, so it's going to go against the action of the trapezius, so it causes neck flexion. It'll also cause a lateral flexion of the neck, so a bending your neck to the side.
The last action is a contralateral rotation of the neck, and this occurs when the right sternocleidomastoid, as seen here, pulls on the head, causing it to rotate left. Our last muscle of the neck is the Splenius Capitis. And this muscle here, it's the highlighted one here, and it's quite deep to the others. And what I've done is I've faded some of the other muscles so you can appreciate its relation to the ones we've talked about. So this would be your trapezius here, this faded muscle here, and the sternocleidomastoid right in here. The origin for the Splenius Capitis is along the spinous process of the cervical vertebrae, right along here, as well as the thoracic vertebrae, a few of them there. And its insertion is on the mastoid process of the temporal bone here. One of its actions is its synergistic action, or works along with the trapezius muscle, in that it enables the extension of the head or neck as well as the hyperextension. Now this is one where it has a synergistic action or a similar action to our sternocleidomastoid, and that is also going to cause a lateral flexion of the neck as well. Now we have another example in which our Splenius Capitis has a relationship with the sternocleidomastoid, but this time it's actually antagonist. So as we saw earlier, the sternocleidomastoid will actually have a contralateral rotation. So the right hand side will cause a left rotation. However, the Splenius Capitis, the left hand side will cause that left lateral rotation.